As the COVID pandemic rages on throughout the country, states are holding multiple primary elections for all levels of government. In Massachusetts, on September 1st, a Democratic primary will be held. In District 8, where Holbrook is located, there are two major candidates. Incumbent Representative Stephen Lynch, who has represented the district overall with some redrawing of the borders for almost 20 years. Lynch is one of the more conservative Democrats in the state and has described himself before as a pro-life Democrat. The other candidate is Dr. Robbie Goldstein, who works at Mass General Hospital. Dr. Goldstein is running to the left of Lynch on a progressive platform and has been endorsed by former presidential candidate Andrew Yang, Bernie Sanders founded group Our Revolution, and other progressive organizations. Could you give some background on your career before you started running for office?
Absolutely. So I am a physician. I'm an infectious disease doctor. I'm actually sitting here in the hospital because I continue to see patients. Largely what I've done over the past 10 years has to been a primary care doc for folks living with HIV, people in the LGBTQ community, and people affected by substance use. And over the past 5 years, I've actually done a lot of work with the transgender community, the trans and non-binary communities. I've built a clinical program, the Mass General Transgender Health Program, to provide primary care and hormone therapy and really links into the hospital for trans and non-binary folks of all ages to come in and get the care that they need. So I am kind of leaping from a very different space. I'm leaping from medicine and the hospital into government and politics.
Yeah, and moving into that, why do you think the 8th District needs a new representative?
You know, this is a district that has changed dramatically in the past 20 years. Congressman Lynch was first elected in 2001, 19 years ago. And since then, we've had redistricting happen. We've had people move into this district that weren't living here before. We have seen a more diverse constituency build in this district with people moving in from all over the world to the 8th District. And I think that as that has happened, the values of the district have shifted and changed. And this district no longer really is represented by its congressperson.
What are some major policies that you're campaigning on?
Certainly healthcare, right? I can't be a doctor and not campaign on a healthcare platform. And I like to say that I think everybody in this country deserves healthcare. I think we need to fight and fight and fight for healthcare for all. The way we do that is to push forward with a single payer healthcare plan that will allow us to make sure that we address the three biggest problems I see in healthcare: access, cost, and equity. And we can address all of those through a single payer system. But I'm fighting for more than just healthcare. I'm not just a healthcare candidate. I'm someone who wants to fight for the Green New Deal and urgent action on climate change. I want to make sure that we are addressing racial inequity in every policy that comes out of Washington. And I think that we need new voices and a new perspective to address some of these enormous challenges that we've been facing for a long time, like gun violence, that haven't moved forward.
What are some differences between your policies and Representative Lynch?
So I oftentimes call it three big differences between us in the way that I would vote and the way that he has voted. I think the first is to say that he voted against the Affordable Care Act in 2010, the largest healthcare expansion we had in this country since Medicare and Medicaid, and he was on the opposite side of that issue. I think the second is reproductive rights, and he's repeatedly voted against reproductive health care and describes himself as pro-life. And I am unapologetically pro-choice and believe in reproductive justice. And then I think the third is the LGBTQ space and his tepid support or lack of support for the LGBTQ community and my full-throated support for the LGBTQ community. It's the community I live in. It's the community I work with every single day in the hospital. It's a community that needs a leader in Washington.
Do you think more doctors should run for Congress?
Absolutely. I think that doctors and healthcare professionals, right, nurses, public health professionals, people who have been in a hospital, have been around healthcare, I think they bring an incredibly unique perspective to governing. Now, we don't need all doctors down in Washington. That's not going to solve our problems. We're going to end up with people with all the same perspective, but we do need to make sure that we have diverse opinions and diverse perspectives in Washington. And I think in particular, doctors have this ability and this experience that they sit with people one-on-one and they hear from them the real challenges that people are living with every single day.
Moving on to COVID, what do you think of the state's response to the virus?
You know, We were a state that got hit really early on in this pandemic. And if we kind of can think back, it's hard to do, but if we think back to March and April, Seattle was hit first, New York City came next, and Boston was soon after that, right? And I think in the beginning, we ramped up as quickly as we possibly could, faster than so many other states did. And I really think that's a testament to the hospital systems here in Massachusetts, the healthcare providers who were working 24 hours a day, 7 days a week to make sure that we could take care of people, and the people of Massachusetts who listened and wore masks, distanced themselves, and did what they needed to do to decrease spread of the virus. Certainly, we had some issues in the way that we managed this in the beginning, and I think we could talk about a lot of those details, but I'm really proud of what Massachusetts did and what MGH did. I think that now the big next step is to recognize that we are not through this. We are still in the first part of this fight. And what I would love to see in Massachusetts is continued messaging about the importance of masks, continued messaging about the importance of physical distancing. I think we have to be very, very careful about moving into phase 3, which is what we started this week, recognizing that 40 states in this country have rising rates of COVID. There are only 2 states, New Hampshire and Vermont, not Massachusetts, that actually have decreasing rates of COVID in this country. And so we've got to be very, very careful about reopening to avoid a second wave that could really overwhelm us.
Yeah, as you said, most of the states are increasing, but what do you think the federal government should do? They passed a couple bills already, but what more do you think they should do in combating this pandemic?
Well, the bills that they passed back in March and April were a huge first step to get our economy back on track, to make sure that healthcare providers had what they needed, to make sure that every individual in this country could work through the economic recession and this healthcare crisis. But actually, so many of those programs are about to expire at the end of this month. And we need Congress to act now. We need the House and the Senate to come back and to extend unemployment, to think about rent and evictions, to think about emergency cash relief to so many people that are still unemployed, furloughed, out of a job, facing continued physical distancing because of the rising rates across this country. I think Congress has a job to do, and they've got to get down to Washington and do that job.
Where can people go to support your campaign?
So people should check me out at robbieforchange.com, ROBBIEFOR change.com. There, people can sign up for our email list. They can sign up to volunteer with the campaign. And for people who can, they can make a donation. This is a campaign that is entirely funded by grassroots donors, people who are engaged and energized by the message and the mission of this campaign.
This will be an interesting race to watch over the coming weeks. This has been Andrew Luarasi with Code Blue News, signing off.